The curve of urethral instruments. From these considerations, it follows that the curve of the urethra is the curve of its roof. Now, the entire anterior urethra is freely movable with the penis and can be made to assume any curve. Not so the posterior canal. The membranous urethra, bound tightly at its extremities by the two layers of the triangular ligament, is the real fixed point of the urethra and runs at a distance of from 1 to 2 centimeters, 2/5 to 4/5 of an inch below the symphysis pubis. In front of this, the bulbous urethra tends slightly upward because of the tension of the suspensory ligament and of the skin and fascia, while a similar elevation is given to the prostatic urethra behind by the puboprostatic ligaments and the anterior fibers of the levator ani muscles. Thus is formed the so-called fixed curve of the urethra. Not a true fixed curve, for by depression of the bulbous and the prostatic urethrae to the level of the membranous portion, it can be, and often is, transformed into a straight line, as when a sound is pushed home until its shaft is in line with the patient's body, or when straight metal instruments are introduced. The curve varies slightly in different persons, and in the same person at different periods of life, being shorter and sharper in the child, longer in the old man. An enlarged prostate lengthens the curve. Footnote: the proper average curve, as recognized by Sir Charles Bell and insisted on by Sir Henry Thompson and Dr. Van Buren, the one which will mathematically accord with the greatest number of urethrae, is that of a circle 8.125 centimeters in diameter, and the proper length of arc of such a circle to represent the subpubic curve is that subtended by a cord of 6.875 centimeters long. An instrument made with a short curve of this sort will readily find its way through the normal urethra into the bladder without the employment of any force. It is very desirable that instruments intended for habitual use should be so constructed, inasmuch as many of the difficulties of catheterism are due to a defective curve in the instrument employed. The defect most frequently encountered is too great straightness of the last half inch, a deviation of the curve at its most important point. In an instrument properly made, it will be found that a tangent to the axis of the curve at its extremity will intersect the projected axis of the shaft at a little less than a right angle. If the curve comprised only a quarter of the circle, the tangent would meet the projected shaft at a right angle. But instruments made a little longer, as they are usually found, invariably have the last part of the curve tilted off into a faulty direction, making the angle between a tangent to the axis of the curve at this point and the projected axis of the shaft obtuse and falling within the right angle.